5 health checkups seniors over 70 should rethink. What doctors don't always tell you: there are 5 health checkups that individuals over 70 should seriously consider avoiding. While they may appear routine or even life-saving, they can sometimes do more harm than good. Many seniors remain unaware of a quiet truth, one that's rarely discussed in doctors' offices. Each year, countless older adults undergo medical tests, trusting they're making smart choices to protect their health. But what if I told you that some of these precautionary tests could actually increase your risk of unnecessary surgery, stroke, or even cancer? According to recent research, nearly 37% of medical tests performed on seniors lead to unnecessary treatments, complications, or long-term side effects. Even more shocking, asterisk, 99% of people over 70 don't know they are being subjected to excessive and sometimes harmful screening. Asterisk. One of these tests, ranked first on our list, has been linked to 5% of all cancer cases in the US, a rate comparable to cancers caused by daily alcohol consumption. Yet you won't hear this discussed in waiting rooms or see it on billboards. It's buried in scientific literature, and today, we're bringing it to light. In this video, we'll walk you through 5 routine medical checkups that seniors should reconsider, along with the alarming physical, emotional, and financial toll they may take. These insights are grounded in the latest medical research and real-life stories that might sound eerily familiar. The test that came in at number 2 might genuinely shock you. Before we begin, I want to hear from you. What's your age and location? Have you ever regretted taking a medical test or undergoing a procedure? Do you believe seniors today are over? Share in the comments. We're reading each one and offering personalized responses. Don't forget to like this video and subscribe for more eye-opening health guidance tailored for seniors. 5. Bone density scan. This test may seem harmless. It's quick, painless, and doesn't require any needles. You leave with a number telling you how strong your bones are. But here's what's often not discussed. Beyond age 70, a bone density scan may cause more anxiety than it offers benefit. The DEXA scan is commonly used to detect osteoporosis, especially in women. However, mild bone loss is a normal part of aging, just like getting wrinkles or gray hair. Yet many seniors with osteopenia, a borderline condition, are prescribed drugs designed to increase bone strength. Unfortunately, these medications come with severe risks, from jaw necrosis to esophageal inflammation. Even more troubling, research shows that treating mild bone loss in those over 70 does very little to prevent fractures. A study from the Journal of the American Geriatric Society followed over 1,200 women above 70. It found that 0.3% over 5 years. Asterisk. A minuscule benefit compared to the side effects. Let me introduce you to Rose, a 76-year-old retired piano teacher. She was active, walked daily, and had no falls. A DEXA scan revealed osteopenia, and she was put on a list. Within 3 months, she suffered severe acid reflux and jaw pain. She couldn't play piano anymore. We stopped the medication and instead created a natural plan: vitamin D supplements, resistance band workouts, and a diet rich in calcium like leafy greens and sardine. A year later, Rose performed at a recital with stronger legs, better balance, and most importantly, no fractures. A 2022 study in osteoporosis international backs this up. Strength training, balance exercises, good nutrition, and vitamin D can reduce fracture risk by more than 20% without any pills. The takeaway: don't let a scan dictate your life or push you into taking risky medications. 4. Brain MRI for mild memory loss. Forgetfulness is scary. When seniors misplace keys or forget names, the fear of dementia can be overwhelming. So doctors often order a brain MRI to check things out. While this test sounds helpful, here's the truth. Most brain misters in people over 70 don't find anything actionable. Instead, they show normal age-related changes like slight shrinkage or white matter spots, both common and harmless. But once those spots are found, the worry begins. Seniors are referred for more scans, spinal taps, or even brain surgery, often without real medical necessity. A 2021 study published in Neurology Today examined over 3,000 MREs in people aged 70 to 85. It found that 86% showed abnormalities, but only 3% were treatable. Meanwhile, 12% of patients underwent invasive follow-ups, often unnecessarily. Let me tell you about George, a 74-year-old retired engineer, sharp-minded but forgetful. He got an MRI that showed white matter changes. His doctor mentioned possible early dementia. George panicked, stopped driving, stopped going to church, and fell into depression. When we reassessed him using a simple cognitive test, he scored well within normal. His MRI changes were completely typical for his age. After focusing on better sleep, hydration, and brain exercises, George returned to his routine with renewed confidence. So unless symptoms are severe like seizures or a sudden personality shifts, a simple cognitive screening test should be your first step, not an MRE. Number 3. Cardiac stress tests. If you're over 70 and mention fatigue or minor chest tightness, you may be sent for a cardiac stress test, which tracks your heart's response to exercise. Sounds reasonable, right? But here's the catch. Stress tests are known for false positives, especially in seniors. The rate can be as high as 40%, meaning your heart might look blocked when it's perfectly fine. And what happens next? More tests, angiograms, maybe even unnecessary stents or bypass surgery. A major study in JAMA Cardiology revealed that over half the stents placed following stress test referrals were in patients who had no real symptoms or benefits. Worse, they didn't live longer or feel better but did suffer from side effects: bleeding, kidney damage, longer hospital stays. Meet Raymond, a 75-year-old ex-postman who walked daily. During a checkup, he mentioned fatigue on steep hills. He took a stress test. The results were inconclusive, so doctors performed a catheterization and inserted a stent. But Raymond had a bad reaction to the contrast dye, leading to kidney issues and a 6-day hospital stay. In the end, his fatigue was never heart-related. It was just dehydration and skipped meals. If you're not experiencing classic heart symptoms, like chest pain during exercise or shortness of breath, a stress test may do more harm than good. Instead, a resting EKG or a coronary calcium scan can provide safer insight into your heart health. 2. Colonoscopy after 70. This one may surprise you. Colonoscopies are often seen as life-saving, and they can be, if you're under 75 or have symptoms. But beyond that age, the risks start to outweigh the benefits. Preparation involves powerful laxatives that can cause dehydration and kidney issues. The sedation may lead to confusion, memory problems, or even heart rhythm disturbances. A 2019 study in JAMA Internal Medicine examined over 1.3 million seniors. It found that among every 1,000 colonoscopies in people over 70, only 2 lives were saved, while more than 20 people suffered serious complications. A 10-to-1 risk ratio. Even if polyps are found, they're often small and slow. Removing them in older adults may cause more harm than good. Let's look at Dana, a 73-year-old bakery owner with no symptoms. She underwent a colonoscopy on her doctor's advice. The procedure caused internal bleeding, and she spent 2 nights in the hospital. She now follows a non-invasive approach, annual fecal immunochemical tests, and dietary adjustments rich in fiber. It's safer and keeps her thriving in her bakery. In the next part of this video, we'll reveal the #1 health checkup that seniors over 70 should be most cautious of. It is the one most deeply tied to increased cancer risk, yet most people have no idea. And yes, there's a safer, smarter alternative you need to know about. The #1 most dangerous test seniors over 70 should rethink. This is the most surprising and least talked about test that seniors over 70 undergo, often thinking it will save their life. But studies now reveal this test is responsible for a growing number of cancer diagnoses. Cancers that may never have caused harm. And yet, once detected, the path often leads to radiation, surgery, and months of suffering. We're talking about the PSA test, the prostate-specific antigen blood test, a common screening tool for prostate cancer in men. 1. PSA test for prostate cancer. At first glance, it seems like a no-brainer, a simple blood test that detects prostate cancer early. But the truth is far more complicated. Here's what doctors won't always tell you. After age 70, most men naturally experience an increase in PSA levels, even without cancer. But this can trigger a dangerous chain of events. A high PSA score leads to a prostate biopsy. That biopsy might find a slow-growing, harmless cancer, but once found, doctors often recommend radiation or surgery, even when it's not necessary. And here's the worst part. Most of these cancers would never have spread or caused symptoms. A groundbreaking study published in the New England Journal of Medicine followed over 1,600 men with prostate cancer. It found that men who chose not to treat low-risk prostate cancer lived just as long as those who had surgery or radiation. But the untreated group avoided erectile dysfunction, urinary and life-threatening infections. So why are so many men still being screened? It often comes down to fire and habit. Let me introduce you to Ibrahim, a 72-year-old retired professor from Chicago. He went for a routine physical. His PSA was slightly elevated. A biopsy followed. It found cancer slow-growing and non-aggressive, but his urologist suggested surgery just in case. Ibrahim agreed. Post-surgery, he suffered nerve damage, could no longer maintain erections, and dealt with urinary leakage. His cancer was gone, but his quality of life was shattered. The sad part, his cancer may have never harmed him. Instead, men over 70 should ask their doctors about active surveillance, a smart and safe approach that involves regular monitoring, not immediate treatment. This allows men to live life fully without the risks of aggressive therapy. So what should you do instead? If you're over 70 and being offered PSA screening, colonoscopy, or stress testing, ask questions. Here are 3 to always ask your doctor. 1. What will we do differently if this test is positive? Asterisk, asterisk. If the answer is vague, think twice. 2. What are the risks of follow-up procedures? Understand the chain reaction the test might start. 3. Asterisk, asterisk. Are there safer alternatives or lifestyle changes I can focus on instead? In many cases, exercise, nutrition, sleep, and regular basic checkups asterisk can give you more benefit than risky screenings. The bigger picture, we live in a world that often confuses more medicine with better health. But aging well isn't about more scans and surgeries, it's about informed choices, gentle care, and a focus on quality of life. Many seniors are caught in a medical maze, but you don't have to be. You deserve care that's compassionate, cautious, and wise. Not driven by fear, pressure, or profit. Your next step. If this video helped you rethink even one test, please give it a like. Share this with someone over 70, it could save them unnecessary pain. And let's talk in the comments. Have you or someone you love faced over-testing or over-treatment? Let's share stories, let's protect each other. And don't forget to subscribe. More expert-backed, eye-opening health insights are coming soon, always with your well-being at the center. Stay strong, stay informed, and remember, less testing, more living.